Understanding unstable angina and myocardial infarction. In the case where a clot partially obstructs the artery, the cardiac muscle it feeds still receives oxygen, but in potentially limited quantity. A clot formation in the arteries, like in any other blood vessel, is a dynamic situation. The body has a blood coagulation system, but it also has a blood clot dissolution system. The two mechanisms usually work in harmony. The first serves to stop up a breach in a vessel, and the second regulates its amplitude. These two mechanisms are like the yin and the yang. In constant interaction, they can vary the size of the clot. Moreover, small pieces of the clot can detach and end up further down in the artery's branches, causing small distal obstructions. This fluctuation causes symptoms that can vary with time. In a classic case, chest pain and discomfort come and go in the form of multiple episodes of varied duration and intensity, either as a result of physical activity or not. This situation is unstable. The artery could become completely blocked at any moment. This is what we call unstable angina. You should consult a healthcare professional promptly in this situation, and ideally, make your way to the emergency room. The usual treatment aims to reduce blood coagulation and thus slow the forming of clots in the coronary artery. For this, we administer tablets to be taken by mouth and a medication into the veins. The second step is to perform a coronary angiography and possibly an angioplasty, which is a non-surgical intervention to repair the coronary artery responsible for the symptoms. In the case where the clot completely obstructs the artery, the underlying cardiac muscle suffers. This becomes a race against the clock since the cardiac muscle dies quickly without oxygen. The heart cells that die from lack of oxygen are not able to regenerate or be replaced, unlike the cells of other organs. The affected portion of the heart no longer contracts. This situation permanently weakens the ability to pump blood. The seriousness of the infarction depends on how large a portion was deprived of oxygen and is susceptible to die. The symptoms of an infarction can vary from one person to another, but they generally resemble the following. The person can feel significant and persistent chest discomfort for longer than 30 minutes with or without nausea, vomiting, shortness of breath, cold sweats, and weakness. The pain can spread to the left arm and sometimes to the right arm, the jaw, and the back. The symptoms can feel like the worst indigestion ever. It is not uncommon to notice small chest pains in the days preceding the infarction. This discomfort is felt during activities, but also when resting. The discomfort is brief but recurrent, as if the body were sending warning signals. In fact, these are the mechanisms regulating the size of the clot that are already active in the coronary artery, i.e., this is already an unstable angina. In addition to having repercussions on the effectiveness of the cardiac pump, the infarction can affect the heart's electrical functioning. Palpitations can occur and may even lead to death. Still today, a high proportion of patients with a heart attack die before making it to the hospital. Coronary heart disease is in large part responsible for sudden deaths. A rapid response is therefore crucial. An infarction is an emergency situation. Dial 911 immediately. It is not uncommon for patients to consult a doctor later than they should, thinking wrongly that the symptoms would go away on their own. The earlier the doctor makes a diagnosis, the sooner treatment to unblock the obstructed artery can be done. As with unstable angina, the treatment consists of reducing platelet activity and coagulation. Above all, it is urgent to quickly unblock the artery responsible for this vascular event in order to minimize or avoid permanent damage. Go to icardio.ca to discover a wealth of information about heart health.